So good morning, everybody, and welcome to Tuesday Talk. We're delighted you were able to join us. This is the last Tuesday Talk before Christmas. Everybody is getting ready for the holiday, and I thought I'd share a sort of a funny story. One of the traditions that our family has had for years is our original house did not have a fireplace, and so the kids had come to Pat and said, well, oh my gosh, some of my friends in first grade told me that Santa Claus wasn't going to be able to come to my house because we didn't have a fireplace. And so Pat said, oh, don't be silly. Of course that's not true. I'll tell you a story after dinner. So she bought a couple of hours time to come up with a good tale. And so she came up with the magic elf who resides on the tree, and every day he starts at the top of the tree and he works his way down, and eventually, if the kids are good, the elf ends up on the final branch of the tree. And then on Christmas Eve, when all the kids are tucked into bed and all is quiet, the magic elf runs to the front door, opens the front door, and Santa comes in the front door. And so for years and years and years, we used it as an effective parenting ploy. Because if the kids were misbehaving, the elf either climbed back up the tree or the elf didn't move. And so for the 2 weeks before Christmas, we always got tremendous behavior from the kids. So the kids are out of the house, but I was at the tree night before last, and I noticed that the tree was still at the very top. No one had moved it. And, I guess that was Pat's responsibility, or at least I'm blaming her for it. But she says, no, Brant, you've not been a very good boy. And you better straighten up, or the magic elf is not going to let Santa in the door this year. So I am on my very best behavior because I want to make sure I have presents and goodies under the tree. All right, we're going to get started this morning. Lauren Rose has a presentation to make, a drawing. Lauren, come on up.
Happy almost Christmas. So I did a questionnaire, a Christmas trivia questionnaire at the Regency Oaks Experience last Thursday. So I didn't have a great turnout. Apparently the questions were a little more difficult than I anticipated. So 5 people turned in their sheets with their best answers, and I'm going to do the drawing based on those 5 entries. So Jean, would you like to help?
No, this is not it.
Never mind.
That one's coming.
You gonna tell us the names of the 5 people?
I can.
We're going to do the drawing first, okay? Is that all right with you, John? Okay.
I'm going to draw 2.
Open them up and... So this is for a $25 gift certificate to Publix.
Eleanor Finn.
Eleanor? I think I saw her go out this morning. I think today's her birthday.
Oh, well, happy birthday.
And the next winner is Bobby Belcher. So I want to thank everybody that did participate in participating. And you wanted to know the other 3. The other 3. Okay. Fred Green.
Yay.
Lottie Krause. And last but certainly not least, Joanna.
Yay!
I turned mine in at 4:45 yesterday afternoon to the front desk.
I'm sorry?
I turned one in at 4:45 yesterday afternoon to the south front desk.
Well, I apologize, I didn't get it as of 9 o'clock this morning, so I'm sorry. Well, thank you, and I will make sure Eleanor gets her card.
We'll do Jesse.
Jesse? Thank you.
All right, good morning, everyone. For those that don't know me, Jesse Rosalie, your EBS director. Like Lauren, we actually did have a great turnout for our guessing game. So we had a table where you had to guess all the Christmas lights in that globe, as well as how many apples there were there. So we had a great amount of participation, and there's one individual that actually guessed both numbers. No one number less or more. It's incredible because there's two chances, right? But this resident guessed exactly 24 apples that were in the globe and about 60 lights in there. So the resident that won the bottle of wine with the wine holder is Mr. Hank Lashid. Are you here? All right. Well, if you're at home, we'll make sure you get your gift delivered to your apartment. Now, the second person that was about 4 numbers or 4 apples away from 24 that won the stainless steel wine opener, by the way, it's rechargeable, is Ms. Robin Graham. Congratulations. We'll be sure to deliver that to you, okay? But thank you so much, everybody, for your participation. And Mr. Lakeesh, you at home, make sure you get with me. We got to go and play the lotto together, okay? Thank you. I'll pass it on to Mr. Brown.
Could you bring our beautiful basket up?
Absolutely.
Thank you. So we're making sure to spread our holiday cheer at Tuesday Talk today. So, take these out. Okay. Can you pull it for us?
Can you pull my own?
Yes. Perfect. That would be amazing. And our winner is P407 Studebaker. Yay! So that worked out well for you. Thank you. I'm going to sit it right here.
Any more prizes?
That's it.
That's
All-
it.
all good on
All
prizes.
the holiday joy is spread.
Yes.
All right, Robin and Chris, I think you may have an update for us on recycling. Oh, thanks.
Major production this morning.
Happy holidays. Chris is going to take it away.
Well, since it is Christmas time, there's a lot of mail, presents being given out and sent. And the first thing is recycling wrapping paper. It's recyclable. Just crumple it up, put it in your recycle bin. Now, Christmas cards are another thing. Excuse me. These cards can be recycled, but the best way to do it would be take it to the card shop and the arts and crafts room and recycle it that way, and they can make new cards out of it. If you're a little shy and don't want to see the message shared by the folks in the card shop, then you can still put it in the recycle bin. Wait, excuse me, I got a frog this morning. And you can put it in the recycle bin. And but what Sue and I do is that we save them for the following Christmas. No, I don't use them again. What we use is that we can cut out parts of it and use them as tags on the gifts. So we've done that for a lot of years. Now, I say you can throw them into the recycle pile, but there's always a however. A lot of cards, and I just got these from the card shop, have little ribbons on them. Not recyclable. If there's a ribbon on them, you have to throw it away.
I don't think you mean that.
Well,
It won't go in our paper recycle, but the
the
card people will
card shop will take
recycle.
it.
They
That's the
will
first step,
recycle.
take it in the card shop. Also glitter. Glitter, whether it's on the card or on wrapping paper, glitter is just little tiny pieces of plastic. And they just spoil the whole batch of recycling. So no glitter and no ribbons. But first step, they take glitter and ribbon cards in the Arts and Craft card shop. And since we're talking about Christmas, packages come to the front door of every north and south. So I'm going to turn it over to Johanna because she's going to do a demonstration. You got that?
I guess so. They called in an expert to do a demonstration. Well, you know, your box comes and you slip the top open and you can get your gift right out of there. And then, while you're slitting the top open, just turn it over and you have one of these handy little things, I hope. You just slip the blade out again and slit the bottom, and you can open it up, and then it folds up very nicely. That's the way we want to see them in the recycle bin.
It is our theory that if you can get into the top of it, you can open up the bottom of it and flatten it out. There is no way that we could express what a big difference this makes in the capacity of our recycling capability here at Regency Oaks. So have a care, take that extra second and flatten them out, and we'll all be happier. Thank you.
Our COVID update. I know everyone is probably anxious about the tavern, and I want to talk about that. I have nothing but good news. So yesterday we did send out a notice, and we believed we had a broader exposure than we had had in the past. And we had 3 people out for testing. We had 3 people in isolation in a remote area of the community where they could not expose others as we were testing. And the good news is Chris came back as flu-like symptoms. And so we did not end up with a multiple exposure, which is always our concern. We're going to have single exposures. We're going to have those. A person randomly is going to pick up the COVID virus, and you know, our effort is focused on how do you contain it? How do you keep from that spreading from one person to the next? And of course, one of our biggest concerns is close proximity. So if I have 5 or 6 associates who all work in the tavern and one comes down negative, have I now exposed all of the other coworkers and, as a secondary exposure, potentially exposed you? So the good news is we did have 1 exposure. We've done the contact tracing. The other individual that was showing symptoms turned out to be flu-like symptoms. He's tested negative, and so we don't believe we had the exposure that we originally thought we did. And so our approach is always, as I said in the letter, going to be out of an abundance of caution. We're going to take extraordinary measures to ensure your safety, even if occasionally I have to come back the next day and say, oops, sorry, it was an overreaction. So the good news is we don't think we have an exposure. We are monitoring the other individuals that had a potential exposure, associates. They are in day 4, which is right in the onset of symptoms occur between day 3 and 5. And so by tomorrow, if they are not showing any signs and symptoms, they currently are not, then they will be free to come back to the tavern and rejoin the workforce. That also means that we're going to be able to reopen the tavern on Friday. So, I'm not apologizing that we did it because it was the right thing to do, and we did it out of an abundance of caution to make sure that everyone was safe. But the good news is we are going to be able now to reopen the tavern on Friday, and we did not have multiple individuals exposed, which is the best news.
The tavern's not open on Friday. It's just open for grab and go in the morning.
Thank you. She reminded me Friday is Christmas, so it will reopen on Saturday and back to normal operations. But you're right, it is closed on Christmas and closed on Sunday.
But it's open for grab and go in the morning?
Yes,
Breakfast.
yes. For Sunday, or Friday. Okay, you feel better about that?
Yes.
All right, good. Let's dig into the numbers. Okay, we're going to look at the two maps over on the right-hand side. The top one is Florida residents over the last 30 days who have tested positive, and you can see from 11/23 through 12/14, you can see a gradual increase in the number of people who are across the state of Florida testing. It's almost doubled. We were at about 5,500, and it's gone up to almost 10,000 pretty consistently here over the last week. But the good news is, again, look at the resident deaths because of COVID. It's just completely and totally fallen off the charts. And that's what we're seeing throughout the state of Florida, is that we have not overrun our hospital and ICU beds. And so if you do get sick, there is medical care available because the beds are available. In some states like California, if you've been watching the national news on that, they've run out of ICU beds, and they're really having an issue. In fact, they're having to send COVID patients out of state because they just can't find the hospital beds. Not our problem here in Florida, and that's really good. Don, let's go over to Florida testing, the next tab over. Our testing continues to, it's not a total flat line, but it looks pretty good. This red line down here at the bottom, you can see the number of the positivity rate for new cases continues to run somewhere between 6, 7, 8%. It goes up and down, but there's not a significant spike in the positivity rate for Florida. And then you can see in the bar graph right above, it gives you the visual reference between the number of negative cases, which is in green, and the number of positive cases that are in red. And remember, the definition of how we defeat COVID is when the number of negative cases or the number of people who are not sick with COVID completely overwhelm and outnumber the number of people who are feeling symptoms or have had a positive diagnosis of COVID. And we clearly are at that point in defining the COVID, where nearly, it looks like maybe 7 to 3 negative, maybe 8 to 2 negative, so that continues to be really good. Yesterday, here in Pinellas County, we tested 5,692 residents. Only 419 of those were positive. That's a positivity rate of 7.36 and continues to look good. Let's go over to cases by zip code. And just want to show you that, yes, we are seeing some improvement across the Florida. All the white and blue are good numbers. Everything that's in red is not so good. And I point this out only to remind you that just a few weeks ago, there were parts in Pinellas County, Safety Harbor, Feather Sound, where we had a little blue, and Pasco County had a little bit of blue, and it looked like maybe there was some improvement or some light at the end of the tunnel for our area. That has eroded a little bit, and so right now, Hillsborough, Tampa, Pasco County, all the numbers are still in the red zone, and they will have to continue to be monitored. Let's go over to health metrics. So chart on the upper left-hand corner is ED visits. These are emergency room visits with influenza or flu-like symptoms. And so what happened, you see this pretty big significant spike here this last week. Exactly what happened in our tavern is we had someone who popped with flu-like symptoms. ED visits or emergency room visits presenting at hospital with COVID-like illness. That's in the purple, the chart on the lower left-hand side. You can see it was stable week over week, and that's looking good. The yellow chart, upper right-hand corner, is documented new cases. You also see stability week over week, and then the same is true for the curative test as opposed to the antigen test, the curative test being the more effective of the two tests. We see stability week over week. So those numbers are good and continue to be very positive for us. All right, Don, if you will back out of this, I thought we'd do fun facts about COVID. I'm not sure there are fun facts, but here's some interesting information that I thought might be useful as we think about going into the Christmas season and the fact that we're going to have family and friends visiting us. And so the first slide. So essential workers. Essential workers are those individuals who are considered absolutely essential and critical to the United States in terms of infrastructure and keeping things going. And here are the positivity rates between non-healthcare essential workers. Those are firemen, policemen, EMS workers. They are people who do not specifically work in healthcare. It's about 17%. And then amongst healthcare workers, and those are physicians, nurses, CNAs, those are the individuals in hospitals and skilled nursing, assisted living communities all across the country. The positivity rate for healthcare workers is about 12%. Now, those numbers are really, really good. And why do you think that is? Anyone have an idea? Who has the best PPE in the country? It's the healthcare workers. We have masks and gowns, and we practice this. We live this every single day. We're more in tune to the regulations and what it takes to be safe. So our positivity rates are in the lowest quadrant in the United States. So that means that nearly 70% of the exposures across the United States are coming from people not in those two categories. So that's everybody else. That's restaurant workers and grocery store clerks and cashiers and family members. And so the highest risk factor that you as residents face is not going to be here at Regency Oaks or over next door in our assisted living and skilled nursing. It's going to be in that elsewhere category. Next slide, please. In the last 60 days, 39% of the new cases have participated in one of the following events in the prior 14-day period before receiving their COVID diagnosis. So nearly 40% of the recent people who have gotten a COVID diagnosis, in the 14 days prior to being diagnosed with COVID, they participated in one of these 3 events. They visited with a friend, they attended a family dinner, or they went out to a restaurant. 40% of all COVID exposures over the last 60 days have come from attending one of those 3 events. That's really, really important information for you to know. Next slide. 34% of that 39%, there was 39%, and of that whole number, 34% of those cases developed COVID from close contact with someone who had no symptoms. And so this is what I hear all the time. My friend or my son is going to come in, he wants to come in and visit, but don't worry, he's fine, he's really cautious, he takes good care, he's not an exposure risk. That may or may not be true, but just keep in mind that 70% of the exposures are coming from outside of Regency Oaks. 39% of the exposures are coming from one of the 3 high-risk behaviors, and 34% of those are coming from someone who shows no signs or symptoms. So I'm drawing a map and sort of connecting the dots for you so it helps you to identify what your risk tolerance is and what risky behaviors you might be exposing yourself to. And everybody is different, right? One of you may be willing to take a higher risk than another based upon your medical condition. Do you have underlying concerns? Are you more or less active? What's your overall health status? How much do you trust friends and families that you may be planning to visit with? All of that has to be taken into account when you start to define what your risk tolerance is. Is that helpful? Yes. All right, good, thanks. So I just want to come back and wrap up with some of our local numbers so that you have a sense of what's happening more specifically in Pinellas County and here at Regency Oaks. In the state of Florida, we went up about 11,000 cases yesterday. The United States went up about 300,000. So Florida is significantly doing better than the rest of the country. In Pinellas County, we're up to 40,092 cases. It went up just about 900 cases over the 24-hour period. And so those numbers are really good. Our hospitalization rate continues to be outstanding. From the start of the COVID back in February 18th, we've had only 3,100 people hospitalized in Pinellas County, and in our specific zip, it's only been 804. So the positivity rate long-term here in Pinellas County since February through today is down below 4%. So the numbers are encouraging, and we just continue to monitor it, pay attention, and be careful. Number of people in quarantine here in the IL, it's 8. Almost all of those are related to hospitalizations or emergency room visits. We have 13 in skilled and 25 in the AL, and that's because we had an exposure. You saw in the letter yesterday, we had an exposure in that area of our building, and so all those individuals are on quarantine as we finish our contact tracing and make sure that there's not been a secondary exposure to residents. For staff members, in the IL, I have 3 staff members on quarantine. Those are the ones that I have isolated. 2 members in skilled nursing and 1 member in assisted living. So you can see I have quite a few people under quarantine, but that's a great way of making sure that we've isolated people, and if they have symptoms, we're going to isolate them until we can either they test positive, but we want to make sure that they're not out amongst the population, either staff or residents. In terms of anyone we are suspecting of COVID that's not in these isolation areas, there are no staff members, there are no residents across all 3 product lines that we suspect of flu or COVID-like symptoms. So we continue to be a really healthy group. I want to also spend just a few minutes talking about this past weekend. We were able to get the vaccine administered to all of our AL residents, all of our skilled nursing residents, and we had about 80 IL staff members and about 60 skilled nursing and assisted living staff members who took the vaccine. And as you know, there was a priority system that the government had set up for the delivery of the vaccine, and it started with the A category were hospital workers. The AB category were skilled nursing residents and those individuals who work in the skilled nursing environment. So because of the fact that our health center is a licensed skilled nursing center, but we're listed as one organization, we were able to piggyback onto that licensing arrangement and get our IL staff, 60 some odd members of our IL staff tested. I took the vaccine. I encourage everyone to take the vaccine. When you take the first shot, you get about 45% improved efficacy. When you take the booster 21 days later, your rate jumps from 45 to about 80% efficacy. And then 7 days after the booster, it jumps to 94, 95% effectiveness. So the shot was surprisingly painless. Has anyone seen it done on TV? So it's a very long needle, and it goes right into the upper muscle. And they jab it in there. It is not sort of like the flu shot, but it was painless because it was going into, it doesn't go into tendon, it goes directly into muscle. And you literally don't feel a thing. It's a the liquid is very, very thin. It's not thick and heavy like a serum. And so you just don't feel it going in. We did almost 300 doses. We only had 2 reactions, and both of them complained of feeling flush and hot for about 5 minutes, and then there were no other symptoms at all. It was easy. I didn't have any issue until the following morning when I woke up and it's like, my arm! I can't lift my arm! And even now, it's sort of difficult to get my arm up. But it was interesting. I was listening to one of the physicians talk about that, and it was on President Trump board. And he was saying that that's a good thing because you know it's effective and it's actually working if you have soreness at the injection site. So we are on our way. I still do not have a date for the IL residents. We did make application. It has been accepted. It is in the processing. The IL residents, as you probably have been following, have been moved down to level 2. There were 10 categories. There was 1A, 1B, and then 2. Our IL residents are in the 2 category, and I don't know when that vaccine is going to, when we can plan on having it delivered. I know we are still in a very high category, and you're going to get it well in advance of the general population out there. The level 2 also has the school teachers. So you're right up there with the school teachers and the at-risk population. So we are a part of that, and we just continue to monitor it and try to keep track of it. There was a tremendous amount of confusion as they rolled this out. We were only the second community in all of LCS, 180 some odd communities in 39 states, to receive the vaccine. So we were a little experimental, and they were a little experimental. They showed up on Sunday. They were 3.5 hours early. You would think that the government could never do anything 3.5 hours early, but they did, and it was a pretty efficient and painless overall operation. So we'll keep you up to date as that develops.
Who would be administering it to us?
Yeah, great question. I was joking last week when we found out it was the Department of Health and the National Guard. I said, Joe Smith, Private First Class, who is a mechanic in the U.S. Army, is going to be administering the shots. And what could go wrong with that? But it actually was very well handled. They had National Guards troops who brought you into the area where they were administering the vaccine. They did the paperwork. There's a pretty extensive paperwork, consent forms, and declarations that they give you about side effects and what to monitor. So the National Guard did all of that administrative and logistics paperwork, and then there were actually 3 Department of Health workers. They almost certainly were RNs or LPNs who administered the shots. But the most interesting part, there was a pharmacist on the team as well. And he sat in the back of the room, and he had a cryo-packed, thermostatic controlled cooler. And this is what kept the vials at negative 95 degrees. And he would take out a vial with big rubber gloves because you have to wear them to keep from burning your freezer burn. He would inject that into some sort of liquid that instantly defrosted it. And so it wasn't like when you go to Walmart and get your flu shot, they put it into the vial and then turn around and give you the shot. He would pull the serum into this other chemical. There would be a chemical reaction, and then he would fill the individual syringes. And so the doses, he would take the 5 or 6 syringes and take them up to the RN who was administering the shot, and the RN was dealing with the syringes rather than the vial and the doses. It was interesting to watch.
Frank, when we are notified that we're going to get the shot, what are you people? Can we have it done in here as a group, or do we have to go outside to get it?
So what we're hoping to do, the question is, what are our plans on administering the vaccine to the IL residents? And so our plan is to be able to do it in a single location and have Regency residents not have to go outside, but be able to get the vaccine at the community. It's going to be done in a large area. It would require something as large as the town hall. We would queue it up by, north building in the morning, south building in the afternoon, and we'd have to, line people up and maybe do some sort of queuing by alphabetical order or room number or something to, so that you didn't end up having to wait in line for 4 hours. But we'll figure that out as we get closer. Now, here's the one thing that is interesting, and we do have this pretty much confirmed at this point. There are 3 shots at this. There is the very first shot where you're supposed to get shot number 1. There's a follow-up visit where you're supposed to get shot number 2. If you missed the first opportunity. They will give you a second opportunity on the booster shot round to come back and get the first shot, and then they'll come back a third time to do the booster shot for anyone who missed round 1 and took the first shot in round 2. But that's it. And so if you're not here, if you're out of town, if you forgot about it, if you couldn't make your morning appointment, you'll not get another opportunity. Right now, they're saying that the general public is not going to get this vaccine until sometime next fall. So there are not a lot of doses out there. You know that we ordered 100 million and got 50, and they're in really tight supply, and so the general population, it looks like, is not going to start to receive these vaccines until early fall.
Is the federal government paying for this?
So there is no, the question is who's paying for this?
We are.
And so there is no charge out of pocket to anyone, whether you have insurance or don't have insurance. However, having said that, the two things they ask for when you walk in the door is a copy of your driver's license and a copy of your insurance card. So they are in fact either billing insurance, Medicare, or a third-party payee source. If you are institute and have no funds or no insurance, then there's no charge to you, but yes, the government is picking it up.
I keep hearing on TV that people over 65 are in the very next group. Well, most people who live here are 65, 75, 85, 95. So we should be in the next group, just because based on our ages.
Yes, yes. So she is correct. The level 2 group consists of school teachers, those with pre-existing conditions, and the seniors over the age of 65. And I think they probably have it broken down into A's and D's. But yes, we are in the second group. That's correct.
Brad, do we have a scheduled time?
We do not. Yeah, there is, at this point, there is no scheduled time.
Brent, the national news yesterday had us on 1A, CCRC. What happened? Now we're number 2?
Yeah.
We
And
were not number 1B or 1C?
yeah, so the government is what happened. So I had this all set up with CVS Pharmacy. We contracted with CVS Pharmacy. They were coming in. They were going to administer the vaccines. The administration date was today, and we'd had this set up for a couple of weeks. And then Governor DeSantis wanted to make in my opinion, a political statement, and so he took Broward and Pinellas County, and he said, I'm going to get this done. These are the two largest senior populations in retirement communities in the state of Florida, Broward and Pinellas, and he said, I'm bringing in a SWAT team. It's an 8-member SWAT team, National Guard, Department of Health, and we're going to make sure that the most vulnerable, the most exposed, the skilled nursing home residents are inoculated, and it's going to happen in a week. And so he is well on his way to accomplishing that. And if the objective was to get the highest risk skilled nursing patients in the two most populous counties done in 7 days, he's going to achieve that goal. But as a result of that, he stepped all over the plans that we had arranged with an outside contracted third-party vendor. And so it's one of those things, and we're now down in category 2, and but we're still high enough up that we are going to get it sooner rather than later. We just don't have a date.
What about allergies that people may have to prevent taking the shot?
So, great question. We were concerned about allergies that people might have and whether or not it was safe to test or to take the shot. And so they do come with an EpiPen in case there is an allergic reaction. We did not experience any allergic reactions, and this is sort of a neat thing that they came up with. So you take the shot, and they take a Post-it note, and if you took the shot at 11, they count off 30 minutes. They write 11:30 on the sticker, and they send you into an observation room with your sticker set for 30 minutes later. The observation room is manned by nurses, RNs, who are just walking the room looking for signs, symptoms, allergic reactions. And when the clock hits 11:30, you raise your hand. She comes over, she takes your Post-it note, you rip it off your Post-it note, and they throw you out. So it was really a great system because you had a couple of RNs that were able to monitor 40 or 50 people at a time, and you had your sticker, and you couldn't go until your sticker said it was safe for you to go. It worked really well. We had no allergic reactions. That was good.
Brent, now with this shot, will it be a professional that's giving it?
It was an RN, and so the Department of Health employs a lot of people, social workers and occupational therapists and skilled nursing specialists, but these were RNs, and so the shots are administered by a nurse who's trained, and by the time this is over, he probably will have given more shots than...
When I got my flu shot, it was an amateur. I was in pain for a week after it was.
Where'd you get it?
Publix, I believe.
Publix, yeah. Yeah, no, these guys are trained, and again, it was amazingly. I was expecting it. I'd heard these stories that it was a very thick serum and it hurt like the dickens going in, and it just none of that was accurate. It was like, what do you mean you're done? So yeah, it was painless. Earl.
Is it Pfizer?
It was. We did take the Pfizer dosage. That was the first to market. We were the third nursing home in the state of Florida to get it, and so it was the Pfizer product.
What's our position on Moderna?
The Moderna shipped, and so it's going to the market, and we should start to see vaccines being administered late this week, maybe. Half a dozen, one the other. I'm not a big fan. Moderna is fine. I am not a big fan of the Johnson & Johnson product. That's the single shot solution, and it does not yet have FDA approval. But I think the Moderna and Pfizer are very similar. All right. Well, thank you very much. If I don't see you, have a very Merry Christmas and enjoy yourself. Thank you.